Good evening, everyone. Myself, Dr. S. Kaur, and I'm a senior physiotherapist at Udai Omni Hospital, Nampally. Today, we are going to talk about back pain, which is a very common issue nowadays, probably because of our sedentary lifestyle. We don't move around much. So, there are specific exercises for that. But in addition to this exercises, I would like to mention that we need to keep ourselves moving as much as we can. So, you can do simple movements like just bending sideways and, just bringing your back backwards and then twisting it a little, maybe on the left and on the right side. This will just relieve the stiffness in your back, especially when you are at workplace and you cannot do anything else. So today I would like to show you a couple of stretches which will help you relieving the back pain and improving the mobility of your back. So the first thing is, can you please bring both the knees? Yeah, can you bend both the knees together? So this exercise is bridging, which is a very simple exercise and a very effective one too, because it involves the muscles of hip, of pelvis area and of low back. So he's placing his both the hands on his tummy. So I would like to instruct you. So the patient has to lift the bottom up till the level so that the knees and the tummy, they come in a straight line. So holding this position for a couple of seconds, 6 seconds, and then coming back to the neutral position. So this is the first exercise that a patient can do, very simple and very effective one. The second thing is stretching, very effective stretch, but this is very effective, but this cannot be done very commonly because you need a good space for it and you really need to put some effort in it. So, but if it's done in a proper way, this can prove to be very beneficial for the back. So this is knee to chest stretch. So can you please hold both the knees together and take them towards your chest. So the patient has to take both the knees towards the chest till the level so that his hips, they go in air and the patient feels a very nice stretch in the back. So can you feel the stretch?
Yes.
Yeah. So holding this position for a couple of seconds and then coming back to the neutral position. So this is the knee to chest stretch. Now the third thing which I'll show is, can you please lie down on your tummy? So the patient has to lie down in prone lying position, means on the stomach. And the patient's, so the patient has to, this is called as back extension, a very good exercise to so as to feel complete stretch in the low back area. So can you please lift your body up, upper body up by putting weight on the hands, yeah, till the waist. So the patient will be lifting the body up and holding this position for a couple of seconds, for 6 seconds, and then going back to the neutral position. So you'll see that you'll feel a very nice stretch in your spinal area. So this is the back extension. Now the next stretch which I will show is that is a Superman exercise, or that is also called as airlifting. So can you come on your hands and on your knees? So the patient's knees should be under the hip area. Okay, so I will instruct the patient to extend this leg backwards to the extent so that the pelvis stops moving, the patient stops shaking at the pelvic area, and then simultaneously the patient has to lift the opposite arm straight up together. Yeah, so this is a very good exercise. This can be held up to 6 seconds or as much as the patient can do, because this exercise will actually focus more on the core stability and on balancing. All right, and then the neutral position, and then repeating the same on the other side and the opposite arm. So again for 6 seconds and then coming back to the neutral position. Yeah. So this really works on the core stability and the patient learns how to balance. So very important exercise. The next one is kneeling down stretch. So in the same position, I'll instruct the patient to just sit down on his feet, keeping the hands at the same position and bending the neck so that the patient feels a very nice stretch in the spinal area. So holding the same position for a couple of seconds, for 6 seconds, and then again going back to the neutral position. So the neutral position will be the same. So this can be done 5 times. All of them, they can be done 5 times each exercise. So as you've seen that I've shown you a couple of exercises which are very important for your back. So you can do them on a daily basis just to prevent and cure back stiffness. But if the pain still doesn't get subsided, please feel free to join us. We have a back school session that's a free class for everyone that we do. That's a 1-hour class which is done on every 3rd Saturday of the month. In this class, we will actually tell you what sort of things they aggravate your existing pain, or what posture should be, how you can manage your postures, whether you are at your workplace or whether you are at home, what sort of exercise should be done, what should not be done. So you can clear all your doubts, so please come and join us, and you can also bring your family, your friends, and I hope these exercises, they will help you. Thank you so much for your time.